So yeah, Josh, let's go through because it's been whatever happened this past week. Um, it seems like a lot of people have asked a lot of questions or asking a lot of questions,
All right.
either from the podcast or all these questions are from TikTok. But a lot of interesting questions from people about TRT mostly, even some peptide stuff.
Okay.
Some of the stuff we've gone over before, so some of these things,
Sure.
but everyone, if you've heard it before, just listen to it. It is what
Yeah,
it
I
is.
think there's definitely a lot of overlap, and we can maybe address it a separate way too.
Yeah.
It's always possible.
All right. So let's jump into this one. This was the first one. It says, "Hello, I'm hoping to achieve some answers for an upcoming surgery for my 18-year-old son. I know that you, oh, hold on, this part I have to read and then stop. I know that you are very well versed in all things medical and peptides, which is why I'm questioning." That's a full stop. We're going to stop right there. Now, before anyone fucking sends anything, I am not well versed in anything medical or peptides or anything other, like anything in the medical field. Okay. Do I know some things about it? Yes. Can I help you and maybe, answer some questions for you? I can try my best. But I am in no means fucking a well versed medical professional. So let's just put that out there. Okay. So
You sure?
I appreciate it. I mean, I did sleep at a Best Western one time, so maybe that. So it says. So I read that. I had to read that two times. I was like, "Is this my mom sending me this?" Okay, so he is going in Monday for surgery for a multi-ligament tear on his knee from a recent football injury. Could you please tell me what peptides would be best for recovery, and do you introduce those right away post surgery? I really appreciate your time. So, 18-year-old son, multi ligament tears, playing football. What do you think?
Yeah, I mean, he's if he has ligament tears, he'll need surgery,
Hmm.
obviously. Um, I have in our clinic and have had really good success um, with BPC and TB 500 starting day one recovery, day one post op um, surgery
Does
on
his age
orthopedic
have
injury.
anything? Is 18 too young or too like?
No, it's not. I mean, I'll be honest. He's 18. He probably doesn't need it. He'll probably recover just fine,
Hmm.
because he's still young. Um, but it's not going to hurt anything. Peptides as a whole operate as signalers, right?
Hmm.
They're just going to tell your body to do something it already does, and just kind of enhance that process.
Okay.
Is really what we're looking to achieve, basically, with a peptide, like growth hormone secretagogues, right? Signal, well, hit the receptor at the pituitary, tell your body make growth hormone. That's
Hmm.
literally the the point of it, right?
Right.
So these kind of stimulate a couple processes, increase VEGF to help repair tissues, ligaments in this case, um, and can help him recover faster. I have a guy on my hockey team that had to have rotator cuff surgery, suffered a bad fall. This was in my spring session league, and we got him on BPC 157 parentheses pentadecaarginate. Sorry,
Hmm.
um, same thing, ish. Don't attack me, peptide crew. I know
Right.
there's a difference.
Oh, they're coming.
I'm doing the layman's terms here. And TB 500. We did it day one post op, and we talked then afterwards, and he's like, "Yeah, my PT's like, dude, what's going on? You're 3 months ahead of therapy
No
schedule."
shit.
Yeah,
3 months ahead.
3 months ahead.
Damn.
So, and that was off 1 month of both running them concomitantly together.
Yeah. No
So,
shit. How old
yeah,
is this guy?
50s, early 50s, great 50s. You'd never tell.
Yeah.
Like he's got a young looking face, baby face. You know what I
Yeah.
mean? Yeah,
So he's advanced 3 months,
he's
or he's
three
three
months
months
ahead of
ahead.
schedule.
Oh, just from adding that too.
Yep, his
Oh, no
PT was
shit.
like blown away. He was like, "Dude, what is going on?"
Yeah.
I'm not, he's like, "I don't see this after this surgery this quick," and he's like, either the surgeon was really good, and I think he did have a good surgeon. So
Hmm.
But he's like, this is insane. He told him, and he's like, okay.
That's
And I've
enough proof.
had, I have another client that does a lot of MM. He's a trainer,
Hmm.
has an MMA gym. And so I get some fighters that get referred to me from him that have, injuries. And we had a guy with a shoulder injury, and he was able to get full range of motion with his shoulder after 8 weeks.
He needed surgery too?
He did not need surgery.
Oh, okay.
We were able to help him not have surgery, and he was able to have full range of motion of his shoulder after 8 weeks, which he was blown away because he was told it could be months
Right.
before he would get full range of
Who's
motion
that
again.
was BPC then too?
Same combo. Yep.
Oh, and TB. Okay.
Mhm.
No
Yep.
shit.
Pentadeca arginate and TB 500.
Hmm.
The Wolverine stack, as they like to say it. But yeah, it works really well. I mean, I've also, I mean, you've used it, I've used it,
Yeah.
so we kind of have our own views. And I want to preface this by saying everybody will have their own experience different from everybody else. So just
Right.
because somebody has a fantastic experience, I mean, I think by and large, um, that will be, you will have positive benefit, but
Right.
I can't say it's going to like save you from having to have a knee surgery or,
Right.
having your shoulder cleaned out or whatever. You may be able to kick the can down the road a little bit longer, but
Yeah.
I think, push comes to shove, you're probably eventually going to have an intervention for certain individuals for certain
Right.
injuries for that type of stuff. So it's not a miracle, but it is pretty dang effective at improving, those injuries, lifting injuries, that type
Yeah.
of stuff. You're in the gym and you got, your shoulders bugging you, and you do that, and
Yeah.
a
The
month later you're like, wow,
my
okay,
my when I took it, obviously I took it for tennis elbow, and I didn't really notice anything until probably I only took it for 4 weeks. I probably should have obviously taken it longer.
right,
And I did notice week 4, there was something in week 5 after I was done that I did notice some improvement. The
hmm
other thing is that I tried to tell people, because I was telling people, like, I haven't really noticed much as far as, an improvement up until that point, is that I also work in construction. So
correct,
that grabbing motion, it's not like I was just resting. I couldn't rest. I was still
right,
picking up drywall, still doing whatever it is that you do. So it's not like I was giving that muscle or that injury any kind of rest. I mean, I
correct,
tried to not use it as much, but it was like, maybe
yeah,
10%, 20% of what I normally do. So still getting worked. And so,
yep,
I don't think it's like a miracle where you just take it. I still think you need to rest and still,
you
like,
do. You
right.
do. And that gets you better. I mean, it's not that you can't use that area, but you don't want to go bench press, if you just
Exactly.
hurt your shoulder, right? Because that's going to be terrible.
Right.
But doesn't mean you can't do like a modified chest exercise that takes a lot of stress off your shoulder
Right.
too.
And
Um,
I did it with a straight bar when I was doing curls.
uh-huh,
I felt it when I did it. Like the way how your wrists are turned like that.
uh-huh.
And I was curling up, and of course I was going heavier than I should have because I'm a fucking idiot. And I felt it and I knew it, and it is what it, but when I still worked out, I just didn't do that exercise. I
Yeah.
did other things that, like, when I would feel it, I would stop and I would try to change, an angle or something to do it. But in all fairness, and I try to tell everyone, because, like, yeah, that didn't work for me either. I'm like, yeah, it didn't. Like, listen to the whole story here. Like, I didn't.
Right.
If you were able to, like, if you worked in an office or you were able to let it rest, it probably is going to work better than, obviously it does something, because I have never heard many people say that it doesn't do something.
I haven't had anybody come back, and we ordered this. This is probably the second. It's a close run. The growth hormone secretagogues and BPC TB combo are run, like, I just ordered this today,
Right.
literally on a person. So this person's used it before too, and it does wonders for them. And obviously, I wouldn't have people coming back placing reorders if they didn't get any benefit from it.
Right.
And I'm not talking like, oh, I'm just continuing because I ran it a month before. I'm talking, I took this 6 months ago, but I tweaked something else,
Right.
and I want to go back on that because it helps.
And also, I'd like to add too, when you inject it into your body, right? I know
Mhm.
everyone thinks like you inject it into the site, it just stays there, but it
No,
doesn't.
it doesn't.
So
It's
in my
systemic.
in my personal experience, I played rugby in college. I played football all of my life. I'm in the construction business. I have all kinds of fucking injuries, like things I'm just used to. I tore my rotator cuff when I was 17 years old. I never got surgery. And my
Yeah,
shoulder, like it's sometimes will bother me from that. So when I took that, I don't know if it went directly to, it could have went to other areas and fixed those areas
sure.
and
It's
not,
going to go anywhere that has
right.
a problem.
So, if that's your only injury, then yeah, it may be that it does work better. If it's not your only injury, like if you're a blue collar guy that works, you probably have more than one fucking injury,
Right.
let's be honest.
The other thing I want to bring up too is you do not have to inject it at the site of the injury.
Right.
That's a misnomer. I don't know where that came from. There was a small scale orthopedic study done on BPC 157 injected intra-articularly, which is inside of the joint space.
Right.
And I think people just extrapolated that and said, well, they put
That's
it
where you
in the
have to.
joint,
Right.
but that's inside the joint. That's not like in the skin by the joint. That's literally in the
Right.
joint space itself. So, if your shoulder hurts, you don't have to inject it by the shoulder. Just stick it in your abdomen and give it to
Right.
yourself. It's gonna go to your shoulder. So
Yeah.
it's systemic. Like that's how it works. It gets into your bloodstream and goes to work.
I tried to
So
inject. So I did one time because I heard that. I'm like, oh, I'm just going to try it. And I tried to do it in my like elbow area there.
mhm.
Yeah. Fuck that. It
Yeah.
sucked. It
Yeah.
fucking made my elbow hurt for like an
You're
hour.
not gonna fare any better. And
Right.
all you're gonna do is
So I
get
just went
frustrated.
right back to the stomach and I was just like, it'll find its way there.
Yeah.
So, but like well, my story, because people keep saying, well, it didn't work for me either. I'm like, dude, you didn't listen to the whole story here. I'm not saying
Mhm.
it didn't work. It just didn't do that specific. And in all fairness, week 5 and 6, it did. Week 4, 5, and 6, I did notice improvement. And if I stayed on probably for 8 weeks, I probably would have noticed more improvement.
Yeah,
But I just jumped off because I think I was starting CJC at that point.
I think so too. Yeah.
Yeah. And I didn't want to be a pincushion. I'm
Yeah,
not like the
I get it.
hacksmith that could do
The
25 injections a day.
right. The needle fatigue's real. I mean, you do just get tired of like, okay, I got to take this and I got to take this, and like for example, the growth hormone secretagogues have like the rules attached, like no insulin spikes, an hour and a half prior, 30
Hmm.
minutes post. So then you're like, well, did I eat? And like, this, that, and the other, and then you're
Yeah.
like, okay, well, I have to take this one at this time and this one at this time, and you're just like, all right, I'm done.
Yeah. Right. Exactly.
Like I don't want to do anything right
That's
now. I just want to
exactly it.
not worry about my shot this day. So
Exactly.
it is a real thing. It does exist, and it does get annoying for
Yeah,
some
for
people.
sure.
So
So Brett writes a question, and this is actually a pretty common question that I get. Do you get night sweats on TRT? Some days seem worse than others. I've heard it could be high or low estrogen, seems to be what everyone blames, and he sides on. I noticed it's worse when I feel the best, and my dosage and frequency is on point, unfortunately. That's when he notices the night
so
sweats.
I've actually had a guy come off due to profuse sweating on testosterone.
Came off
He
completely from it.
came off completely. He said it's too bad. We were going to try and adjust his dose, but this particular individual is extremely busy a lot, and I think he's just like, you know what, like I'm just gonna go back to the way it was.
No
Um,
shit.
yeah, I don't think he was in the gym like he was supposed to be either. And we were trying to adjust his dose, but he's just like, I'm sweating all the time. Now, I don't know what his diet was like either. If you eat a lot of protein, you obviously can. Protein has a much higher thermogenic index than anything else. So,
Right.
for the term the meat sweats before,
Yes.
yeah. So, if you eat a lot of protein, you will get hot. I mean,
Yeah.
it's literally what it does. Um, so it could be a result of that. It could be a result of the type of mattress that you have and the sheets that you're sleeping on. I mean, there's a lot of variables to that
Hmm.
for night sweats. I don't. I'll be honest with you, and the several hundred men we have in our clinic, I don't really have anybody complaining of night sweats.
Yeah.
Um, it's not a common complaint. Can it happen? Sure.
Yeah.
But again, is it the testosterone? I think it's one of those things. It's just got so many variables. It's hard to be like it's
Yeah.
this, or this. It's probably just a combination or a scenario that gets created. So
Yeah. I always, because I've never had the night sweats, but I sweat a lot normally. I
yeah,
always have. So, I don't know if there's any difference from being on TRT. I haven't noticed anything that I'm
right.
sweating more that I know of. You know, the only thing that I did know or noticed is in the summer, I will get like a rash in my where my elbows are.
Okay.
That maybe that's a little bit more sweating because I'm outside.
Could be.
Maybe that could be it, but that's the only thing. And it's only
Yeah.
like July and August, and then it goes away.
Yeah. So I don't know. There's just a lot of variables I think you'd have to evaluate to kind of pick that one
Yeah.
apart a little bit further.
Okay. Let's see. Let me go to the top of this one. All right. It says, oh, hey man, thanks for posting about completing intimacy. This has been an issue for me, very frustrating. Your post prompted me to call my doctor and make an appointment. Fingers crossed, we will figure it out. So he's another one with the unable to complete or get to completion during intimacy.
Did we address this in a prior
We did.
episode?
We just talked,
Yeah.
I think we talked about it either last one or 2 episodes ago.
I was gonna say, yeah, like I still don't have a clear cut answer. I don't think anybody does, to be honest with
Nobody does. I've gotten
you.
about 50 different things that
Yeah,
guys have taken.
yeah.
Someone said to take pregnenolone
Pregnenolone.
or pregnenolone
Yeah,
or
it's a
whatever.
pro hormone. Probably not going to change a whole lot.
Isn't that what
So
my wife takes?
your wife takes progesterone.
Oh, progesterone. Okay.
Pregnenolone is a precursor to that. So pregnenolone is called the grandmother hormone. It is the first hormone cleaved off of cholesterol, or cleaved from cholesterol, I guess I should say.
So what will that do? As far as like if you're
So pregnenolone, it being a precursor to progesterone. So then you have a couple subsets: allopregnenolone, progesterone, and then DHEA, testosterone. There's like a kind of a cascade of hormones that get made. Cholesterol is your parent steroid, by the way. It all comes from cholesterol.
right.
Um, the DHEA has been shown to have some erectile function benefits. Pregnenolone is to have a calming effect. I am not aware, and it could be. And I'm not aware. So uh, that it has a calming effect. So I use it for men that have sleep issues. So my sleep cocktail, for example, for guys is 30 milligrams of pregnenolone, and I think it's three or 5 grams of glycine. I can't remember the dose. I have to look it up. I have it like in a thing. I just click a button and off it goes because they're supplements. You don't need
Right.
a prescription for those. And that tends to help out quite a bit. I know some people use melatonin too. And but no, pregnenolone is unlikely to change any sensitivity related
Okay.
issues that you may have.
Someone wrote DHEA as well too.
Yeah, I will use DHEA in that circumstance, but not
Okay.
necessarily pregnenolone.
Okay. So do you think DHEA may help?
Sure,
Obviously, it's a huge thing.
especially in guys over 40. Yeah, start with 25 milligrams a day. Maybe bump it to even 50 milligrams a day and see if that makes a difference. Yeah, obviously you're gonna have to give it a couple weeks, but
Okay.
yeah.
That's worth a shot.
Yeah, and if you can get a DHEA sulfate, so DHEAS level drawn, and see what it is. If you know, the level I think runs from like 75 to like 400 ish
Hmm.
is sort of the range, or like upper 300s. I don't have it off the top of my head, but if you're in like the lower range, you may want to try to get it to the higher range to see if it can benefit you a little bit. But
Okay.
guys that are older eat that stuff up,
Yeah.
so they may require it. Younger men usually aren't as low.
Okay. Let's see. This is Kyle. Kyle wrote, my test is at 400. I am 22 years old. My doctor says it's normal. I think he's full of shit. What do you recommend? It says, I am a pipe fitter and I eat pretty clean. I get 6 to 7 hours of sleep and I work out all the time.
Um, how old patient? Yeah,
22.
yeah. I would not recommend testosterone in men under the age of 26, personally.
Yeah.
Um, I don't know. When I was 22, I I didn't have any of these
I
issues.
know. Me neither.
I don't think a lot of guys. So I don't know. Here's the thing. I don't know if it's a true issue or if there's just so much social media out there that like talks about it now,
Hmm.
and
Right.
it's like this, that, and there. So I'm not trying to discredit Kyle's claims here. I'm just trying to say that, is it sort of this psychosomatic subset that we get because, well, it says that fatigue is the number one symptom, and I'm tired, but it's
Right.
like I work 12-hour shifts, and
Right.
I was out with the boys last night, and you know what I mean. So
That's
like, okay,
exactly. That's the thing. There's a lot more. Like, I mean, how often do you drink? I mean, you could still eat clean, but at
sure,
22, I mean, I was eating relatively clean too. But I
yeah,
was also drinking 5 nights a week. Like, so
right. And the reason I prefer to avoid androgens and guys under the age of 26 is because their brain is not fully developed until 26.
right. Okay.
So I try to just kind of not worry about that. You just focus on yourself, your relationships, having a
Yeah.
good time, whatever. It's still pretty early in the grand scheme of things, right? Because then we got to bring in all sorts of other aspects like fertility. Now, if I have somebody that has like a true hypogonadism that's like has Klinefelter's, for example, which is
Hmm.
two X chromosomes and one Y chromosome, then yes, I will absolutely treat that person with testosterone because they will never produce
Right.
adequate. They're infertile, so then I don't have to worry about fertility. It's baked in out the gate. Okay, and they need testosterone. I actually have two patients with Klinefelter's.
Yeah. But those guys, it sound like something that just develops when they're 22 years old. That's been happening their whole
Since
life.
birth, right?
Right.
Exactly. But you don't know it. Usually the people that I've diagnosed with Klinefelter's in the past are like, I can't get my wife pregnant.
Oh, really?
Yeah, and then they come in and you're like, yeah, they get a karyotype done and they're XXY.
No
So
shit.
I have another patient with Y chromosome microdeletion and has an issue. So we're treating testosterone on that too.
No shit. Huh.
Yeah. Had a
All
heart
right.
transplant patient.
Oh yeah, you're just saying that.
Yeah.
That should be
Yeah.
fun.
It's great guy. Really looking forward to seeing his progress. But, a lot of people would get nervous in those. Not me. I'm excited.
That's it.
I like the difficult cases, man.
Yeah.
Bring it on. I like the medical conundrums and where people are, afraid. It's
His
calculated
doctor is
risk.
okay with it. Like he said to,
He's on like almost no meds. I mean, obviously he has to take a rejection med because
Mhm.
he's got a part that's not his in his
Yeah,
chest. But
it's fucking
um,
wild.
but no, he's not on any other meds. He sees his cardiologist regularly. I told him, I said, listen, we're gonna go slow, on you. I'm not gonna run you as high as I would run somebody else until I know you can tolerate this, and then we'll just
Right.
ramp it up, and we'll
Yeah.
just we'll start low, and then we'll just get to a
Increase.
level that
Sure.
feels it is, because sure, testosterone can cause arrhythmia. Last thing I want you to do is have to have an arrhythmia in a heart that's
Yeah.
been implanted into your body.
Right.
um, so these are the things that I'm trying to be aware of, and he's well aware of it too. He's real excited about the plan, so
Good.
I think he's ready to get rocking and rolling. So yeah,
Good.
I'm really curious to see his progress.
So, okay, next question. This guy's a Mets fan, so you can answer him wrong if you want. Um, I've been on let's see, I've been on TRT for 2 years and feel great, but recently my hematocrit was 56. I retested when hydrated and it was 51. Is this a cause for concern? I have a daughter and I don't want to stroke out.
All right, guys, I'm going to bring this out here. There is no, and I literally mean this truly, there is zero documented literature that confirms that increased H&H from testosterone administration causes heart attack, blood clot, stroke. None.
It's a
Doesn't
very
exist.
common thing though with like I guess
Correct.
maybe fear tactic or whatever it is, but there's a lot of guys
but
concerned
but
about that.
but there literally is no published evidence on that, and
Right.
I think we have talked about that before. That being said, I think obviously I don't want somebody walking around with a hematocrit of 60,
Sure.
but I think the ranges that we have tolerated here. I want people to think about this for a second. Okay, think logically, right? We always overanalyze everything. It's just best to back it up and just look at it from a logical standpoint. So what is required to form a blood clot, right? We need clotting factors. We need like fibrin, right? We need to activate it. There has to be some type of injury to activate that
Mm.
process, right? We need platelets to aggregate to form that. Red blood cells are the bystander. They literally don't have any part in forming the clot. They just get stuck there,
Right. Exactly.
right? So, so they're part of the clot, but they don't start or continue the formation. I shouldn't say continue the formation, but they're not a part of that process to get started. They're just kind of stuck in the middle there.
So they're not the cause of it. They're just
Correct.
right.
Right. They're just, but since, 50+% of your blood is a red blood cell,
Hmm.
probably going to get those hung up in the clotting cascade, right? And that's what's going to form, and that's what happens. They get trapped in there, and in that clot
Yeah.
formation, and that's what caused it. But they didn't start the fire,
Right.
right? So, what does cause blood clots? Platelets, fibrin. So, in the case of secondary erythrocytosis, increasing hemoglobin and hematocrit because of testosterone administration, which increases erythropoietin, which increases red blood cell production from the bone marrow. Okay, that's that process. And yes, that will increase your hemoglobin hematocrit. And we can talk about blood donation and stuff here in a second. But my point is that is just the process that happens with testosterone. You don't increase platelets. We don't
Right.
increase fibrin. We don't increase clotting factors. We just increase red blood cells. Now, polycythemia vera, yeah, that's a cause for concern because I'm going to increase everything. Okay, everything, right?
Mm-hmm.
So we're going to increase platelets. We're going to increase clotting factors. We're going to increase red blood cells. We're going to increase white blood cells. We're going to increase all of them around the board. Do I run a higher risk of forming blood clots then? Yeah, absolutely.
Sure.
Right. And there's a couple other genetic things. JAK2 can increase your risk for blood clots. So I mean, like there's a couple other rare ones that are thrown in there. So, but again, no published evidence from testosterone that it causes blood clots. So as far as doing donations, I'm pretty liberal when it comes to um, donating blood. Meaning, if you're at a lab core scale and it says hematocrit cuts off at 51%, I probably won't recommend a donation until we're like 55 plus.
Right.
Okay. And even then, I'm generally like, usually I'm going to. And here's the thing: I don't have a lot of people that have that problem
Mm-hmm.
because I've assessed for risk factors that are going to increase it prior to starting.
Right.
And these are going to be like hypoxic risk factors, smokers, sleep apnea, lung disease, that type of stuff, right?
Mm-hmm.
If you assess for those good and you can get those things mitigated, it never becomes a problem. So I don't really have to worry about it. Most of my guys have hematocrit. I mean, I got a couple of people that are high, but they're well managed. They don't have to donate blood,
Yeah.
and they're fine. So hydration will play a role in that, right?
Sure.
Think about it like this: if I put a teaspoon of salt in a cup, okay, and I put 4 ounces of water in it, and I take a drink, it's going to be salty,
Mm-hmm.
right? If I put 8 ounces of water in it, it'll still be salty, but it'll be less salty than it was with the 4 ounces. It's basically how hemoglobin and hematocrit work, right?
Right.
If you've got more fluid in there to dilute it out, it will not come back as concentrated.
Right. Yeah.
So,
Yeah. The hydration's key. I think a lot of guys overlook that.
well, usually traditionally when you do labs, you're fasting.
Mm-hmm.
So, I don't require fasting labs. There's only a few labs that actually require you to be fasted, but the labs that I'm drawing aren't required to be fasted.
Right.
So
Yeah.
I
Good.
hydrate up. I want you to be how you are typically on a normal daily basis, right?
Yeah, exactly. Well, that's the other
So,
thing. A lot of guys will just drink water the day of when they're getting their blood drawn.
mhm.
And I'm like, yeah, well, homie, that just does it for that day. Like you should be doing that
Drink it every
every
day,
day.
right?
Just to skew the fucking test doesn't do anything for you. Just
Right,
like this should be an everyday thing that you're doing.
right. Yeah, and then we get into that chronic donation cycle. And I mean, I can get into the HIF1 loop, but that is going to throw
Right.
everybody for a conundrum, and it's difficult to explain. And I don't think it's necessary to explain it on the podcast, but that's
Sure.
what's happening, why the red blood cells continue to grow in people that have hypoxia. And you donate, you lose your ferritin. Ferritin's
Hmm.
needed to make new red blood cells. And, maybe one time here and there, you're okay. But you do that every 90 days and you're like, why am I so tired?
Hmm.
Because you have no ferritin. You've just tanked it.
Yeah, exactly. All right. Well, let's see. Bobby writes, I keep looking and couldn't find much on, but should you be taking boron with TRT or is it not necessary? Thanks for your, I don't, it says, thanks for your being informative.
Gotcha. No,
Just by driving and typing.
boron had a low quality study done that said that it may reduce sex hormone binding globulin. But what do we know? What do we know about sex hormone binding globulin and total testosterone?
That they move like a goalpost.
Correct. They move like a goalpost. So if people think like, well, I'm going to take boron to lower my sex hormone binding globulin. If I have a total testosterone of 500, okay, these are just theoretical numbers, and I have a sex hormone binding globulin of, let's say, 50. That's easy, 550. Okay. If I take boron, or if I try to treat the SHBG, and let's say I move the SHBG to 25, great. I will no longer have a total testosterone of 500.
Right.
It is going to decrease as well in proportion with the sex hormone binding globulin. Remember, free testosterone, that's what mostly is important because it's unbound, free to use in the body, free to act on receptors, free to convert to estrogen, free to convert to DHT. You do have what SHBG receptors as well. There are some in the prostate. They've just found those, some emerging research on that. But as to their relevance, I can't comment. So, we're just mostly going to focus on free testosterone. In a normal person, pre-TRT and even post, free testosterone usually ranges between 1% and 3% of your total. That means that we'll just say 98% of your total value is bound to protein. If I move the protein down, what do you think happens to the total?
Right.
It moves down too. It's just a reflection of the protein. If I have more people in a room that hold glasses in their hands, and I take out half of them, I have less glasses in the room.
Right, exactly.
So it's like, it's not a hard concept to understand, but people are putting stuff out there because they act like it's the, taking clomiphene and boron.
Right.
No,
right.
Doesn't, no. That is like the dumbest advice I could ever hear, but nevertheless, it's out there.
It's out there by a lot of people too.
No need for boron. It doesn't do anything. It will not necessarily increase your free T. And let's say it theoretically does increase your free T. If you had really high SHBG, of which I'm still not convinced it lowers SHBG reliably. Let's say you have really high SHBG. SHBG has a inverse relationship with the percent of your free T, meaning the higher your SHBG, the lower percentage of free T is to the total. So theoretically, you can increase it because it will be more of a quote percentage of the total. But when I'm saying if you're going to increase it, it's not going to be much.
Right.
You might go up one whole free T point, which is, you're not going to notice that.
Right.
And we put guys on TRT, we go from 7 to 30.
Right, exactly.
So there's a big change,
significant jump,
a noticeable change. They don't go from 7 to 8. And you're like, oh, look, I got one more point of free testosterone.
Yeah, I feel amazing.
Yeah, I bet you do.
Yeah, exactly. Right.
So no to boron.
Okay. Anthony writes, it says, hey, not sure if you will see this, but I have a quick question. I'm 34 and my test is 124. It's extremely low. My doctor won't prescribe me because I have high cholesterol. In your honest opinion, do you think a low dose of TRT will really put me at risk because of my high cholesterol? I'm also at the point of just doing it myself. I feel horrible every day in my life. Thank you for your time.
I'm just going to say this. Find a new doctor. I'll just leave it at that.
I answered Anthony. You know what the answer was? Hey, bud, thanks for reaching out. I would look for a new doctor if I were.
I love it.
That's exactly the answer.
That's perfect. That's a great answer. The thing is I think a lot of people want a lot of these questions.
He wrote back to you, he goes, thanks for your response, man. I'm going to go for it. I was like,
I like, a lot of people want you to answer these questions. And I want people to understand that when I'm answering questions here on the podcast or in a thing, I'm basically speaking in generalities unless I'm talking about a specific scenario. And the reason I say that is because everybody is unique. Everybody has their own medical history. I can't do an assessment and learn everything just from a 3 sentences.
Right, exactly.
Right. So I don't know anything else. I don't know height. I don't know weight. I don't know blood pressure stat. I don't know your meds. I don't know if you have this condition or that condition or anything else. I don't have any other labs in front of my face. I just know what you told me.
Hmm.
And the other thing is it, I'll be honest, like social media is not really a place to get a medical consultation done.
No,
So
absolutely not.
I think it's a great space for us to discuss things
Hmm.
in an open format like we're doing. But I also think it's a poor choice to kind of seek medical advice in terms of like, please diagnose everything I have.
Yeah, especially from a guy who makes penis memes.
Yeah.
That would be the last fucking guy I would ask for
So
medical
I
opinion.
would say you hit the nail on the head. Go seek a qualified, person that can answer those questions appropriately and have the adequate, answers. Um,
Well, I've
Testosterone
gotten,
will improve cholesterol
yeah, I was
down the
going to say,
road.
because I've gotten questions about that. I've answered that it will improve
It does
cholesterol.
down the road. It doesn't do it immediately,
Right.
but down the road, and two, it will, because of the anabolic effects of testosterone. If you start working out, you add muscle, blood pressure is going to improve,
Right.
cholesterol, everything's going to improve with that because you're putting some effort into gaining something out of it. So,
Mm.
but it'll do it just by itself too. It's been shown to do that as well.
Okay. Jake wrote, will TRT work or help with ED?
Man. Hmm. Yes. Yes, it will.
Yes, it sure will.
Yep,
Yeah.
definitely. So, all right, in my clinic, right, I do sexual wellness. So I do P shots. I'm getting a shockwave machine here shortly. I should have had it earlier, but there's just been so many things that have happened this past year. Good
Yeah.
things, not complaining.
Right.
Just it's pushed, the things that we use the least gets pushed to the end of the row, right? Or the things that I want to develop but keep getting pushed back. So at any rate, um, in order to have those things done or corrected, we got to look at testosterone first. That is the
Yeah.
basis of everything, right? And here's the other thing: just because your testosterone, let's say, it comes back at 400, it does it contribute to erectile dysfunction? It could very well be. That's the issue, right? If you have a total test of 400 and your SHBG 60, yeah, your free T probably sucks.
Yeah, exactly.
So it's not the total that we're, like I said, we're looking at here.
Right.
I get guys on testosterone and 6 months later, they're like, yeah, dude, I'm getting a lot of erections at night and like the quality is better. It takes a little while
Yeah.
because you lose those 5 to 7 erections at night that you should be getting. And that tissue atrophies. And then when you go to get a spontaneous erection, blood flow in there just is quite poor.
Hmm.
Also, we have medications and other medical problems that could be contributing to that as
Right.
well. So I have to do an assessment on that. But yeah, can testosterone improve that? Yeah. And that's because it's going to improve nitric oxide production.
Right. All right.
So
Well,
absolutely.
it would definitely will work. All right, Kyle. Kyle asked a question that we just talked about, I believe last week or the week before, but I know we just talked about this. When I got put on TRT, my doctor said that, or she had some men that could not finish when they were on TRT for a while. So she prescribed me granadorelin, and I've had no issues. I take it Monday, Wednesday, and Friday. I hope this helps. This was in regards to that, um, the TikTok about finishing.
Oh, okay. I think we did talk
We
about
talked
that.
about this. Yeah.
And so it's in the other one. And gonadorelin is essentially worthless on TRT. So
Right.
it was tried to be used as like an HCG replacement, but again, given its really short half life and suppression of gonadotropins anyway from testosterone that it can't overcome, it offers zero benefit.
Yep. All right. Let me see. This was, holy smokes. This is really long. We might be skipping this one. Yeah. This is really long. Let's see.
Jane
Nick.
Austen, write you a question.
Yes.
Leo Tolstoy. Got a
Oh,
War
here
and
we
Peace
go.
novel
This is
there.
a good one. Nikki. Hey man, what are your thoughts on TRT with enclomiphene? Doc said to run it so I can keep my fertility intact.
No.
Next question.
Yeah. All right. We talk about enclomiphene. What podcast is enclomiphene? It's like it's
uh,
within the first. I know it was within the first
5,
episodes. I think it's
number
5.
5.
Yeah, go
Yeah.
listen to 5. That'll tell you everything you need to know about SERMs.
Yeah.
Um, I'm going to be using it here potentially on somebody for a fertility related issue, but potentially we're going to see. There's a couple other things on the playbook there, but gonna. So it was a telepatient, so I can't I couldn't do a physical exam. So there's some things that we have to address before we
Right.
head down that road.
But even if you do use it, it's not going to be a long-term something.
Yeah,
This is
3
going
to
to
4
be
months max. Yeah.
right.
Yeah,
Right.
it's temporary. I would never put somebody on that. And I'm not using it for testosterone replacement. I'm using it
That's
for
where I think we
actual
get lost
fertility.
in the weeds about this is that, yeah, it may help the short term, but this is not a long-term fix compared
Right.
to
It's right.
HCG or
It's a long term, and even HCG. I've seen some other people on TikTok recently talking about using HCG to help boost your testosterone. Um, some very prominent ones as well, that are qualified. But here's the thing with that: HCG functions just like LH does. And what happens is if you use this chronically to boost your testosterone, you end up suppressing your gonadotropins anyway,
mm,
and then it can't keep up with to the production of what you have regardless, and then it ends up just not working at all.
right.
And so like it's really just not a it's not a good approach for monotherapy being by
Right.
itself,
By itself,
just like
correct.
using a clomiphene by itself, and clomiphene with HCG, really terrible idea. um HCG by itself, not a great approach. And clomiphene by itself, not a great approach. Ganadorelin, not a great approach. These are all really terrible approaches because they're not going to provide adequate solutions for long-term problems.
Right. Exactly.
So,
Yep.
unfortunately, they are options. They are not good options.
hmm Yeah. And this is a long-term game. This
This is
is
a
not,
long-term game.
yeah.
It's a marathon, right?
Yes.
This is an Ironman,
Yes.
and we have to go about it with that mindset.
Right. Yep. This isn't a cycle like a guy puts out. I'm like, this isn't a cycle, bro.
Mm-mm.
Don't write cycle in here. If you're writing cycle, you're talking to the wrong dude.
Wrong crowd.
Yep. So, all right, TJ, what are your thoughts on some peptides that help with GH, like CJC, hypermorelin, tesamorelin, that can feed cancer cells that lay dormant in your body, especially if you have family history of cancer? I do not think my family has a history of cancer, but I've done CJC, hypermorelin, and felt great. It just scares me for the cancer possibilities.
So there has been, and because I get all these peptide videos that pop up, and there's some new peptide people in the game. One is a qualified physician. I'm not going to name any names, but I think he's got everybody really scared with data on IGF-1.
Mm,
Okay, and that prolonged IGF-1 levels have shown to have increased risk of neoplasm formation, or cancer creation or proliferation of cancer cells, because that's kind of how IGF-1 works. It's going to cause cellular proliferation.
right.
That being said, I think if you're a fairly healthy person and you're going to run a growth hormone secretagogue, even with like a family history of cancer, because just because you have a family history of cancer doesn't mean you're going to get
Right.
cancer.
Exactly.
Just like when I would do an assessment for, hey, did your dad have prostate cancer? And I'd be like, okay, dad had it. Well, did your dad have it at 80 or did your dad have it at 50? There's a
hmm
big difference, right?
Sure.
Well, my dad had it at 80. I'm probably not worried about you getting cancer. I mean, could you get it? Sure. But there's X, Y, and Z factors in play there at that point. If
Right.
your dad was like, I had Gleason 9 disease and he was 48 years old, I'm going to be like, we're really screening you tight.
Sure.
Okay. But that doesn't mean that person's going to get cancer either. That being said, IGF-1 does have that connotation. And yes, it does have some data to back that up. But we're talking about prolonged high levels of IGF-1. And I would say if you're going to run, 3 months of a growth hormone secretagogue, just get your IGF-1 levels checked at the end and see where they're at. Of the people that we check IGF-1 levels on, obviously I screen them for malignancy,
hmm
and we talk about that. When we're getting IGF-1 levels back on people on secretagogues, we're super therapeutic. We should be, okay, but you have to understand that IGF-1 is age adjusted as well. When you're young and in like your late teens, 20s, like IGF-1's level could be, 400 or 500.
Right.
You're not really going to achieve that as like a 40, 45-year-old
Right.
guy.
Right.
So what we do is, the age adjusted IGF range for like somebody in that age range may only be like to 250.
hmm
So we get IGF to like 330, 350, something like that, where it's elevated for your age adjusted, but it's not as high as it could have been when you were like 20,
Right. Exactly.
right? We're just backing it up to what it would have been a few decades ago in your
Hmm.
life. We're not jacking it like,
Get
to
beyond.
800. Right. It doesn't really get to that level. And then, we're not really running these for a long, prolonged period of time where we're just going, year after year. I mean,
Hmm.
the clinical trial that they ran for Agrifta, I'm pretty sure they did for a full year. I know it was 6 months, 26 weeks in the clinical trial. Agrifta is tesamorelin, by the way. And there's no receptor desensitization, so theoretically I think you could run this stuff for for
Six
a full
months.
year.
Oh, for a
Or
full
you could,
year?
run it probably indefinitely, but I don't see a reason why you would.
Yeah.
But I think most people can hit their goal within 3 to 6 months,
Hmm.
assuming that they're trying, right, and not
Right.
just sitting around doing nothing. But that's kind of the controversy behind that. But I wouldn't let a history of your family, kind of dissuade you from considering that. I think you should weigh the pros and the cons to that
Sure.
as being an option. I think you should have a competent person to help guide you, and I don't
Hmm.
think you should be going to uh, you know, forums and just
Yeah.
talking to people on
Right.
like a
Stay
social
off of
media
Reddit.
aspect to kind of basically guide your decision in this. I think you should have somebody that has some real agency in
Hmm.
this type of scenario to be able to help guide you.
And I mean,
And that's
even if it is a concern, I mean, obviously you can bring it up to whoever your doctor is or provider. I mean, is there special tests that they can do if you wanted to get tests done to
for
see if you're
specific
cancer, like
cancers.
yeah, for cancers or
It would just be like the standard ones like colorectal, prostate,
Mhm.
lung if you have risk, unless you had some like really weird cancer. I think there's some other cancer markers you can get. I don't perhaps know them off the top of my head because I'm out of
Yeah,
my wheelhouse there,
right.
but they may exist.
Okay.
I'm just not aware of them.
All right. So there is something you can do. All right. So let's see. So basically, what is your best thing to, or what is the best thing to do? TRT or retatrutide? Can you do both considering Reta is a fat loss peptide? I responded, you absolutely can do both,
Yeah,
but I would definitely give it time if you just started TRT.
I always go hormones first because that's the long play.
Let me see. I'm trying to see. We wrote back and forth a few times. Okay. Yeah, he's 48 years old.
Yeah,
He
so
never answered me on
TRT
how long he's been on TRT. Never wrote back.
hormone hormones should always be the foundation of any peptide consideration, unless you're like young, right?
Right.
If you're over the age of 35, like hormones should be the first evaluation that gets done to get that building block done. Because if that's not in place, you can still lose weight. Obviously, people lose weight without TRT, people lose weight without peptides. It's entirely possible. But it will make it significantly more difficult. And the other thing is you may not even need the peptide. The reason I personally like a hormone approach, and I'm not saying that you can't use both. We've got people in our clinic that are on TRT and GLPs. They complement each other very well
Hmm.
due to combating the lean muscle mass loss, right? That you
Yep.
can have from a GLP because of the anabolic effects of testosterone. It sort of thwarts that, and then
Right.
most of the weight that's lost is usually just fat. Okay. Um, but I tell you why I like hormones better. And you've heard us talk before, and I am GLPs are fine. I don't have a problem with them. But with hormones, specifically with testosterone, we're going to work on training to build habits,
Right.
right? We're going to work on strength training, get you to the gym, do these things that will be lifelong. Whereas if we use just a GLP 1, it doesn't necessarily focus on building those habits,
Correct.
right? It's going to curb our appetite a little bit. Sure, it's going to increase fatty acid oxidization, but it's not necessarily hammering in the fact that I need to actually
Hmm.
work out. I need to actually change
Yep.
these things about my life. Sure, if you eat a McDonald's cheeseburger, 5 days a week, maybe now you only eat it 2 days a week, but you're still eating the McDonald's cheeseburger.
Correct.
The point is like we need to get away from like that type of thinking. So again, it's not that I'm against them, but I think the programming that goes into hormones is much more beneficial down the road than the programming that goes into just solo GLP use,
Yes.
if that makes sense.
Yes. Yeah. So when you say the cheeseburger, a friend of ours is a big Ozempic woman. She's big on it. Hasn't changed a fucking thing in her life other than taking Ozempic. And she's lost a significant amount of weight and she looks amazing.
Okay.
And I told her, I said, have you like even like started walking or any kind of thing? And she's like, no. And speaking with like when you were saying about the cheeseburgers, I said to her, because she drinks like still a lot. And I was like, she goes, well, I've cut back on my drinking. And I
Okay.
was like, okay. I'm like, well, she's like, so that's something. And I'm like, well, you could just cut that out altogether. And she's like, yeah. She's like, well, with the GLP, I'm like, yeah, no, I'm just saying your own mind can tell
Right.
you to not do that. Like, that's what you should be working on. Like, take the fucking GLP, take everything out of it. Just tell your brain to tell your hands to not pick up the fucking alcohol. Like,
Right.
work on doing that. And then you'll see maybe some healthier habits start to form. And
Right.
then it's like, hey, you know what? I'm doing this, I'm doing that. I don't think I need the Ozempic anymore. I'm walking around the block or I'm doing, yoga or whatever the fuck it is. But
Right.
just doing this and still going about your daily life without putting any kind of extra effort into it may be beneficial short term, but I don't
Sure.
think that it's a long-term solution.
The other thing that I really do not like about those particular medications is we know that if you're just on those and everybody says, well, hit your protein goals, you're still going to lose lean mass even if you hit protein goals,
Hmm.
specifically if you're not having stimulus. That they're actively looking into ways to combat that. They're looking at combinations with myostatin inhibitors.
Right.
They're looking in combinations with IGF-LR or IGF-1 LR3, which
Hmm.
is long ligand IGF, which again, as we discussed earlier, could potentially have some implications for that use too. Um, so they're looking at ways to decrease muscle wasting or muscle loss in patients that take that. So here's the other thing. What is the best way to lose weight?
Oh, like you're asking me?
Yeah,
Self-control and
self-control and
exercise,
specific. What type of exercise? Specifically what?
weight training.
Correct. Building muscle is the most effective way to lose weight.
Right.
Why? Muscle increase, the more mass you have on your body, the higher your basal caloric rate. Meaning
Hmm.
that's the more calories you're going to burn doing nothing.
Correct.
And we're doing nothing more than we're doing something.
Right.
So if I can increase the calories I burn doing nothing, which
Yep.
is most of the day,
Yeah.
because I'm not at the gym 24 hours a day. I'm at the
Correct.
gym an hour twice a week, right?
Yep.
I need to build the muscle up so that when I'm not there, I'm burning more calories.
Correct.
And yes, self-control comes into that as well. But the issue with these GLPs, they're losing muscle.
Right.
So then their basal caloric rate drops.
Exactly.
So if they ever have to come off, if it was
Hmm.
1,800 calories before you started,
Right.
and now it's 1,300 calories, guess what? You can only eat that amount or you're going to just
Correct.
blow up like a balloon
Exactly.
because you don't have any muscle on your body.
That's exactly
It's
right.
not an efficient way
No,
um,
it
to
is
go
not a
about that.
long-term solution to this at all.
Yeah, I don't like it as a long-term solution. I think it's a great tool when used appropriately, but I feel like we're kind of getting away from using it appropriately.
Yep.
Um, but hormones always first. Hormones the building blocks to jump off of. If we want to use a GLP on top because we have some weight to lose, yeah,
Yeah.
it's a great addition. Again, I'm not
Mhm.
doing throwing the shade on it. I think they complement each other very well, but because
Sure.
of that protein synthesis added on from the testosterone, we do not see the muscle loss with those. Matter of fact, we can actually build muscle with the testosterone on board,
Right.
um, and increase that basal metabolic rate. So
Okay. Perfect. So, okay, next question. He wrote, Yo, will CJC be completely useless for me? I'm 18 and I'm turning 19. I've heard people say it can be a waste of money since I'm younger, and they say I should wait till I'm older. I'm just curious on your thoughts. Thank you.
again, I don't think an 18-year-old needs to worry about
No,
growth hormone secretagogues at
I don't
all.
think so either. I think it is a
Yeah,
waste of money.
yeah, at that age, it is for sure.
Yeah. Let's see. Oh, here we go. I had a question. Any idea why total T would go up and free T go down?
It's almost like we answered this question already.
Hmm,
Hmm.
that's a tough
It,
one.
So that would be due to sex hormone binding globulin.
Hmm.
So, and just rewind about 20 minutes and it'll be the same answer.
If you look down at the first thing I wrote is SHBG. That's exactly what I wrote
Yep.
down. Oh, that's funny.
Yeah,
Okay.
when we talk about people increasing their natural testosterone values, and they're like, "Hey, I think we talked about this in a prior podcast. Often, we're not necessarily increasing natural testosterone production; we're just increasing sex hormone binding globulin.
Right.
So the total is inflated versus what it was.
Right.
If you become metabolically healthier, because
Hmm.
metabolic instability, metabolic syndrome, pre-diabetics, glucose, insulin, you name it, those are suppressive of SHBG, meaning they're going to drive your levels lower.
Hmm.
And if you change your life around and start eating healthier and doing better
Right.
things, that level is going to go up. And if that level goes up, so does your total testosterone.
Yeah, absolutely. Let's see. It says, "Hey man, thanks for your content. Super helpful. I am 47. I tested at 180 total T a few weeks ago. I've started the process for TOT. Why do you say twice per week injections are better than just once weekly?"
That is going to be due to the half-life of the medication. So the most common esters used in the United States are going to be testosterone cypionate and testosterone enanthate. They have very similar half-lives, 7 to 8 days ish. We'll just say a week for both because on average, it's probably going to work out. I'm sure people come in with the hate on that one, but it's fine. 7
Yeah.
days. So
Right.
cypionate, I believe, has one more carbon uh, to attach to it than enanthate does.
Yeah.
So theoretically, it should have a longer half-life, but um, they're pretty much interchangeable though. So those are going to be the two most common forms of testosterone that's used. Natural testosterone has a really short half-life, 6 to 8 hours ish, right?
Mhm.
Um, hang on.
Yeah. I always tell, I mean, there are some guys that do pretty well with one injection per week. It's not a lot, but there are some that it's okay. They're
Yeah.
okay with it. But it's most guys are two or more.
So what I'm getting at here is the half-life of testosterone is short. The elimination half-life's probably going to be in that because if you look at a testosterone spike, it's going to last roughly 4 to 8-ish hours,
Hmm.
maybe. Okay. Um, of a natural one. These injectable esters have a 7 day half-life ish. Okay.
Right.
If I give you one injection all at once, and then you go 7 days and you don't get that injection again, there will be a range of free testosterone that you feel pretty good at. And then there's going to be anything below that that you don't feel good at.
Right.
And the whole idea of replacement is to reach this floor of free testosterone and stay above that floor.
Hmm.
So it's not about how high it goes, it's about where the floor drops out.
Right.
Okay. So let's just arbitrarily set that at 20 nanograms per deciliter free T. If I give you a bolus, a one-time large bolus dose of testosterone, either once a week or once every 2 weeks, like some places do, your free testosterone is going to go way up. Okay.
Yeah.
But in the course of that week, it's going to come down and it's going to probably go below 20 nanograms per deciliter on like day 5, day 6, day 7,
Hmm.
which means 3 days out of the week,
Right.
you
You're
kind of know
below.
you need that shot. Whereas if we split it into 2 injections, I'm not going to have quite a peak, but on day 2, day 3, day 4, oh, guess what? Now, day 4, I'm hitting that 20 nanogram per deciliter. And guess what? I'm going to give myself a shot
Right.
and it's going to go back up. It doesn't go as high, but now I also don't go below the floor of where I feel good.
Right. Exactly.
So that's why when we're talking about splitting injections up to give better coverage, that's just on a half-life basis. And then we also have the SHBG basis too, which I know we've talked about because androgens, all of them,
Hmm.
are suppressive to SHBG. So if I have somebody that has a really low SHBG, I have to figure out a protocol to not destroy what little SHBG they have.
Right.
Maybe they're metabolically unhealthy, and that's really the reason why it's
Yeah.
low. But their testosterone's low, and it's kind of like the double-edged sword conundrum. Like, do you know, this person's going to need testosterone to get the energy to go work out to improve their SHBG, but at the same time, it's going to lower their SHBG. So
Right. Yeah.
you kind of have to figure out a way. So I always tell guys, it's not that I can't give you anything to bring that level up. You have to do it on yourself through diet, exercise,
Yep.
your lifestyle. I have to control your descent as to how much that's going to drop. And that's how we craft protocols.
Right. Exactly.
So,
Yeah. Yeah. Diet and working out are a huge part of this. Some self-control, working out, doing it yourself. Too many people are relying upon their provider or their doctor. It's like you have to do some of the work too.
you have to have some agency in the game, right?
Yeah.
You have to meet it halfway. If you
Yep.
don't meet it halfway, you won't gain. You'll
Right.
gain what you'll gain out of it, and then it'll stop, and then you'll be like, I'm not great. Well, you give a little, you get a little.
Right.
It does get to a point where it's pretty much a one-on-one exchange. Like when you go to the gym, you'll see the results.
Right.
It will no longer be I'm going for a month and I don't even notice anything. You'll go for a month, you'll notice some things.
Mm-hmm.
Other people might not, but you will.
Yeah.
If you're new,
Exactly.
right?
Yeah, for sure.
And that creates motivation to continue to go.
Yeah, 100%. Let's see. Tom writes, "Hey, I have a question I have not heard on the show yet, but my feet have been swelling, and I've read it's probably from the TRT or HCG. If so, do you happen to have any recommendations?" So I replied back, "How long have you been on TRT?"
Ooh, I was just getting ready to ask that.
He replied, 1.5 months.
Oh,
So I wrote back, "Just give it time." It's like,
beautiful, dude. It's like you've done this for a million
yeah,
years.
once I Googled it.
It's like hormonal fluctuation.
But there is a lot of people that ask about that, about water
Progesterone
retention.
production. Yep. It's
Just
a
have to
very
let it.
common thing within the first
I had it. It
4 to
was
6 months.
terrible when I had it. Dude. I couldn't even bend over to tie. I felt like I was a balloon, and then
Mhm.
it just slowly started to
Yeah,
dissipate.
if you're on creatine, a lot of guys are on creatine
Yep.
because they're starting it all at once. That's going to
Yep.
really make you hold water for
Yes.
sure.
Yes.
And it's okay if it's intracellular. You do not want extracellular water. That's when you're going to notice it.
Right. Yeah. Yeah. So I was on creatine too, and I couldn't even tie my boots in the morning. That's when I was like, I got to do something. I
Got them
felt
Vienna
terrible.
sausage toes.
Yeah. Actually, I did stop taking creatine for about a month during
Mhm.
that. And then in that month time, I started, you could feel that it was getting
You
better. And
could
then I
feel it
started to
getting better.
increase
Yeah.
the creatine again.
Yeah, I've used to recommend that right away, but I've been holding off on creatine till we at least get to like our first follow up,
Hmm.
and then saying like, okay, we can slowly bring it in now. And I
Right.
will say it seems to have lessened the swelling complaints.
Yeah, I can imagine.
So
Let's see. Hey man, I recently tried lowering my testosterone dose to manage my high estrogen levels, but I'm still experiencing side effects. I'd love your advice on a few things. Number one, how does estrogen blockers work, and should I consider using them temporarily to help regulate my estrogen levels? Number two, what are the typical ranges for healthy estrogen levels in men, and what should I aim for? He's from Washington State. He added that.
mm,
So,
probably has something to do with Washington State.
yeah,
It's probably something in the water. No, I'm just kidding.
probably all this shit from uh, Oregon, all the weed.
All the weed.
Yeah,
Well, I think Washington grows it too.
yeah, they're all high.
One, listen to the estradiol podcast. I think it's
Yeah,
podcast number 2 because it's such a hot thing. Go listen to that. Understand how estrogen functions in men. It is not the same as how it functions in women, at least until menopause.
right.
It will have various factors as to why serum estradiol exists. I do want to make it known that estradiol's primary goal is to bind to the estrogen receptor. If it's in your blood, well, maybe let's put it this way: if its effects are required for it to be bound to the receptor and to cause gene transcription, if it is in your blood and I can measure it,
Hmm.
is it bound to the receptor? No.
That's what that would mean.
So Um, testosterone, and here's what you'll say. Well, you draw blood for testosterone. Correct. Estrogen's role is literally to just bind to its receptor site and cause gene transcription of
Right.
where it is needed. And that is very specific places in your body. Testosterone, on the other hand, wears many hats, has more than one job, which is why we measure it in the serum. It is what's called an endocrine hormone. Estrogen is not an endocrine hormone in a male, it is an intracrine and paracrine hormone. So why do we measure testosterone in the blood, and why do I not look at estradiol in the blood? Testosterone being an endocrine hormone, it's a nomad. It is meant to travel. Why is it meant to travel? Because it has to do many things, and in order to do those many things, it has to move. It can't stay locally in one area. So if I'm measuring your serum testosterone, I get a good picture of what's traveling everywhere to do those processes, because it's supposed to do that. Androgen receptors, estradiol, conversion via aromatase, DHT via 5-alpha reductase. And so the more testosterone we put in your body, theoretically, the more estradiol you'll create at the tissue site.
Right.
But also, the more it'll dump its excess back into the bloodstream. So we'll measure that. And there's other things that can skew that number and make it look higher. And then it's like, oh, it's bad. And really, it's not bad. It's just a product of, and that is body fat.
Mm-hmm.
Body fat will negatively skew your estradiol levels higher because, remember, testosterone is going everywhere. So it's going to go to your body fat, and you need it there to lose it too.
Right.
Okay, that's why it's making it. But it just dumps its excess. So if you think of every little place in your body that makes estradiol, your testes, your liver, your bone, your brain, and it's making estradiol and it's dumping its excess back into the bloodstream, and that's what we're measuring. It's every place dumping it back. It's this multiple factories sending
Mm-hmm.
its waste back into the river that is your bloodstream. And that's
Right.
what you're measuring. Okay. Typically, estrogenic effects that we see in patients, if they have estrogenic effects, are within the first 6 months.
Mm.
And that is because they're adjusting.
Right.
They have gone from having low testosterone and low estrogen, at least at that tissue site, right, to now having adequate estrogen. And there's some changes. So I would also challenge, what do you consider to be an estrogenic side effect?
Right.
Right. And like, what would you consider that to be? Is that water retention? Because sure, we see water retention, and estradiol can be shown to do that, but it's transient, does not last.
Right.
Right. You don't have problems with it. Your estrogen 60,
Yeah.
right? I don't have problems with it. I did when I first started, but I don't now.
Yeah. Right.
And my estrogen's 35.
Mm-hmm.
So the point being is estradiol is a test that it does not need to be run. And I think it creates so much anxiety because people hear so many
Right.
things around it.
True.
They're like, what should this be? What shouldn't this be?
Correct.
Don't look at it,
Yep.
because it's never going to be a problem.
Yeah.
Period.
So
Just
someone
don't even worry
messaged
about
me
it.
today with the with an estradiol. I don't think I answered, or I answered them. I didn't put it in here. But his numbers were 64 or 65 or something.
It's fine.
And I asked him, I said, if do you have, he said his doctor is concerned and wants to put him on not dim. So
Okay. So DIM functions like an AI.
right, right. It's just, but I said, um, do you have any symptoms of high test or high estrogen? And he said, not really. So I said,
Mhm.
well, listen, do you know your body fat percentage? So he wrote back, he thinks it's around 25 to 27%.
That's high.
So I wrote back to him, I said, if you got that closer to 20%, then see how you feel then. Because
Mhm.
your numbers are probably going to start to come down.
Yeah, absolutely.
You're
Yeah,
going to,
they're
so
negatively skewed high because of his
right.
percent
I
body
said
fat, but
before
it
you
doesn't mean
jump
that.
on dim or jump on anything else, let's concentrate on getting the body fat down to 20%,
And
and
then
then
we'll be an
maybe
issue.
closer to 18. And then, start working it down to where you're
Right.
at a healthy level. And then let's start talking then
Right.
about,
And the other thing I will champion here, and I know you know, we didn't check our estradiol at puberty.
no, nobody did.
Right. So why is it all of a sudden an issue, right?
Right. That's
I can go back, and I remember there was a time I was probably 16 or 17 years old that I had a time where I had really sensitive nipples, and I was like, "What the shit is this?" And I had it for like a couple weeks, and it was almost kind of painful, like when you pushed on it, like that's
hmm
how like sensitive they were. And then it went away, and I never had it again.
yeah.
Now I don't have breast tissue; I just had that period of time. Now that I know more about this, as because this is what I do, probably estradiol at that time,
Right.
and I was probably had really high testosterone. But did it cause it? No, it just it happened and it went away.
Right.
You know,
Yeah. The whole argument with the checking estrogen and balancing it or whatever they say, because I think people throw out there's a percentage that
yeah.
it's
There's like a
supposed to be,
ratio. It's supposed to
right,
be
a
like
ratio
10-1,
correct.
and there is zero published data on that.
Correct,
That is
because
complete
my
bullshit.
question is, how many fucking 19-year-olds do we know their ratio, and how many of them do we give aromatase inhibitors to? The
None.
answer is zero. We don't even ask them about it. And their testosterone is peaking, if not on the way to peaking in the next few years.
Right.
So, it's not going to get any higher for the remainder of their life. This is the peak of where it's going to be.
Correct.
And we haven't checked their estrogen. We don't ask them about, are they retaining water? They
Right.
just go about living their life.
Now, I think you can make the I know somebody's out there going to be like, well, you're using a longer acting testosterone
Right.
product. So, and I know that's going to come up, but it
Yep.
still eventually works its way out where it's not a problem.
Correct.
There are changes, and sure, you can have some mood lability where you're sad for sometimes. You can
hmm
have some nipple sensitivity. You can have some water weight. But after 6 months, these are almost never an issue. I do see issues with high free T in some individuals. They can't tolerate higher free T values.
Mm.
So we do have to adjust their protocol and bring it down. It's not the estradiol that I'm concerned about, it's the free T.
Yeah. Okay. All right. Let's see. Paul. Hey, man, I was just listening to your latest podcast and made me think of a question I've been dealing with. Do you have any experience or know what would help with acne once starting TRT? Been on for about 8 months, and acne is the only negative side effect I've had. I use the usual benzo peroxide, but I didn't know if you or your doctor on the podcast have any experience with treating stubborn acne from TRT. Thanks for all your advice and experience given.
I do.
Were we just talking about this before? We were just talking about this before
I
we
think
got
we
on here.
were.
Yeah.
Yeah. Um if it's cystic acne, like true cystic acne, I actually have a patient that has that. And there's a way I like to approach it. So first thing you could do is try to get your carrier oil changed to MCT if you're in grapeseed, if it's truly an issue to grapeseed. Sometimes that helps. So first thing I'll do is just try to switch the carrier oil
Yeah.
from grapeseed to MCT.
hmm
I'm currently on MCT, just sort of litmusing myself out. I feel like it helped a little bit, but I wouldn't say it was like profound
Right.
because I'm still getting like stuff on my shoulders and stuff. And you know, I think people want this like flawless, good looking skin, and
Correct.
I mean, what you had as a teenager is pretty much how it's going to be as an adult for the most
Right.
part
Right.
on testosterone. So if you got acne as a teenager, you're going to get it as an adult on testosterone. It's just going to happen. If you didn't really get it that much as a teenager, you probably won't get that much as an adult. And that's how it is. It's generally not as bad, but it can definitely be. I do have one person with cystic acne. There is some steps you can go through for that. I always recommend salicylic acid wash, body scrubs, get all those dead skin cells off. You are going to make skin a little bit quicker because of estradiol's effect on the pituitary gland and GH release verbatim just from TRT, meaning you will make skin a little bit quicker on TRT than if you weren't. Okay.
Yeah.
Even without a growth hormone secretagogue. Growth hormone secretagogue, it'll grow real fast. Okay. So, meaning a lot of dead skin will accumulate. You can get even more acne theoretically on a growth hormone secretagogue than you did without it
Mm.
because of the dead skin clogging up pores and all of that. Okay. Um, Salicylic acid wash. Neutrogena makes one. I use it. Works pretty good. They make a benzoyl peroxide skin wash that you can put on the area. I use it on my shoulders. I don't use it religiously. I probably should, but it does a pretty good job.
Okay.
So
Yeah, that's
it
what
kind
he's
of
using now, and he's using the acid wash too.
yeah, and I would say that's good. The next thing would be to consider doxycycline. They have that in like a gel that you can put on the areas if it's there, or you can take oral doxycycline. Can be a little hard on the GI tract in some individuals. So if you do it, you probably want to eat, but it's a half dose of a standard antibiotic dose that you would give. Taken doxycycline many times, so doesn't agree with my stomach very well. At least it didn't as a kid. I actually took it as a kid for acne.
Oh, really?
Yep.
Did it help?
No, I couldn't tolerate the doxy, man. I gave me horrible heartburn when I was a kid.
Yeah, that
sucks.
sucks.
It was miserable. It was like it wasn't even worth taking. I was like, fuck this. I'll just deal with this.
Fuck it. Yeah, exactly.
I'll just deal with it.
Yeah.
And then obviously there's isotretinoin, which is Accutane, and that's sort of a last resort. That particular gentleman that I have with that cystic acne, we have him on that, and we have him on daily microdosing of that. So
does it work well?
He is. I started him at the lowest because I wasn't sure how he's going to progress. And you don't leave people on this forever. You don't have to take it for a period of time. But I just bumped his dose to the next step, and we're going to see how he tolerates it at that. Because you have to watch some liver enzymes and stuff. Prescribing that is a bitch.
Oh, really? Why?
Yeah, well, I mean, this guy's in his 40s, so like, there's no risk of him having kids, but it can cause tetragenic effects in fetuses. So, like, if you become pregnant while you're on it, there's a high risk of the baby.
Oh, no shit.
Yeah, you have to sign what's called the I pledge in order to get it, and it has to be signed by the provider. And then what it does is like, so there's like a website you have to like log into it. I have to put in all the patient's information. I have to fill it out. And then I have to put in their email, and it sends it to the patient. And then it says like this. It says like this long list of stuff. They have to read it, and then they have to sign it and acknowledge it to say like, you're aware of these risks, and it lists them all out. And then they have to sign it, and then it emails me back a code, and I have to put that code in with the prescription in order for it to be filled. And you can only order 30 days at a time with no refills.
And then
so every 30 days, I have to
do that every 30 days.
Yep, every 30 days.
Oh, fuck that.
It sucks. And I have to put that code in every time I send it.
Jesus, that sucks. Yeah, I wouldn't even fuck around with that.
Yeah, so it's a pain in the ass. So it is the very last resort for recalcitrant cystic acne. I only have one person. I mean, if you get a few big ones on your back, that's not a reason to use it, right? Like, this guy has his whole chest is coated.
Oh,
it's
really?
bad. Oh yeah, it's just the whole thing is covered.
Yeah,
so
that
like
sucks.
You can't even see any skin in between the next piece of acne. It's like
Jesus, really?
Yeah.
Fuck. Is that painful?
It's not enjoyable. Yeah.
Fuck.
So, but he has shown improvement so far. We're just going to keep it going. I think he'll have to probably run that for 9 months to a year.
All right. There's two more questions in this one. I was going to say for the last, but we'll just do the second to last.
Okay.
Hey, I started TRT a month ago, and I was wondering how long a multi-use vial normally lasts. I shouldn't take it past the beyond use date, correct? And I wrote, correct. And then he wrote, I am with motorcycle meds, and they told me that I can use the vial for 2 to 5 months after the beyond use date.
Wow.
I wrote, and then I want to use before. What did he say? But the beyond use date was 9/20. All right, so he was just saying what the date was, and I won't use it after. I was like, yeah, I wouldn't. I'm like, if that's what it says, I would just go by what it says on the vial.
Yeah. So here's the thing with beyond use dates. We call them bud dates. Okay. United States Pharmacopoeia, USP, they have guidelines on any sterile vial that any multi-use sterile vial once punctured has a 28-day life, meaning you can only use it for 28 days and you should get a new one. That's not going to be the case. Like, that's any sterile vial. So realistically, that's the testosterone that you use, even though there's 10 cc's in it or 5 or whatever. USP guidelines are saying it's only good for a month. Okay. That's stupid. Like, I know when I worked in the hospital, we had to replace insulin every 28 days because of that stupid ass guideline. I mean, we might use a quarter of it out of there, and we're throwing the vial away, and it's perfectly fine
Right.
because of the USP guidelines, which, as expensive as insulin would be, people are saying how expensive it is, and here we're throwing vials away because it's not good beyond that. It
So you
is.
do have to buy more then, right?
Correct. So that might be there. So then the pharmacy will have sort of like their own sort of kind of expiration on the product that goes in that. And that's going to be longer than 30 days typically. So the pharmacy will usually put out their bud date. And it's usually around 90 days. Okay. Give or take, it just depends on the type of product that they're putting out. Of which the amount you get should probably last you roughly around that time anyway, meaning you're going to probably be due for a new vial really close to the time where that bud date's up. Okay.
Right.
So I wouldn't necessarily say that. I mean, could you use it past it for like a little bit? I would say that was fine, like maybe a week or two, but like you're probably going to be ready for a new vial at that point anyway. So just get a new vial.
Yeah.
I don't know why they're saying, 2 to 5 months beyond the bud, unless it's like a weird pharmacy thing where it's just like that 28-day and it is good for, 4 months. I don't know, but it just sounds like the education wasn't provided very well there.
Right. I mean, 5 months after? I mean, that seems
5 months after the bud, I mean, unless they've tested it that long. But I don't know. I don't know what their bud is, if it's a month or if it's 90 days or whatever, because what they do to get that date is they test it after it's been sitting for a period of time to confirm that there's no degradation over that period of time.
Now, I would imagine that they're probably covering their ass and saying that this is the date. So a month, maybe more. Okay, I get
right.
But 5 months?
Right. They wouldn't
excessive.
be able to necessarily guarantee you that the product hasn't suffered some type of problem or sterility issue, right? From being a multi-use vial for 5 months past its best use date.
Yeah.
I think that's probably
that sounds correct.
And I don't have anybody, like if I prescribed you, well, I do, and we prescribed it today, and 3 months go by, you're going to need a new vial. And if you didn't, and if that vial was sitting in your thing for 5 months, would you use it, or would you just call me to get a new vial?
No, definitely not. Definitely not 5 months. 5 months is a long time.
Correct.
Yeah. Especially
5 months after that 3 months.
After, right. That's what I'm saying. So if you did it for 2 months and then stopped, and it was a 3 month, I mean, you're 8 months into this thing now.
Yeah.
Like total. Yeah, I wouldn't.
I mean, if you have the option, if like, there's no reason why they shouldn't just order you a new vial at that point. To me, it sounds like there's probably a little bit of, tomfoolery at play there.
There's some fuckery about.
Fuckery about.
Yeah. All right. So this is the last one.
Okay.
I've been listening to the podcast and I love it. I don't know how TikTok works, but I wanted to ask you a question. Is this message private? I wrote, sure. So, thanks. Maybe a question for Josh's team, but I'm tempting my second go at TRT. The first attempt I had bad. Is it prostasis? Is that how you say that?
Prostatitis.
How do you say that? Prostatitis?
Prostatitis. Yeah.
Jesus Christ, you fucking people! Can't you just write red or something like something? Tried it for 2 months and got rid of it. Had to stop TRT and it went away. I was enjoying the benefits of TRT, but the how do you say it again?
Prostatitis.
Prostatitis.
There you go.
Sucks.
Nailed it.
I'm attempting my second go at TRT and it feels like my prostate is getting inflamed again. I guess it's causing enlargement. PSA has always been low. Any other followers have this issue? I can't find much on the web. Thank you.
I don't have anybody that have developed prostatitis from TRT.
What is that?
Prostatitis could be easily treated, or it can be a pain in the prostate. It's inflammation of the prostate. Now, it can either be infectious or it can be like a chronic inflammatory process not caused by an infection. Acute prostatitis can be life-threatening. That shit is serious. It can kill you.
Really?
Oh my, yeah. Those dudes are sick AF.
How does that happen?
you get an infection into the prostate. Either it can be caused from an STI. It can be caused from, I've seen guys just get it from like a bladder infection. I've seen guys get it from colon infections. Okay.
Hmm.
It's hard to say how you got it, but acute prostatitis. So when you do a digital rectal exam, this is going to be my urology point here. When you do a digital rectal exam and we're going in and we're feeling for your prostate, I'm going to demonstrate this bottle here. So we're going to go in and we're going to push down and we're going to feel your prostate. And it should sort of feel like the area, like if you were to make like a fist, like kind of between like your thumb and your pointer finger there, like on that
Okay.
soft tissue. It should be firm, but have a little bit of give,
Right.
right? In patients with prostatitis, if it's cancer, for example, it feels like a rock. It feels like you're pressing on a knuckle.
Oh,
Like the
Jesus.
whole prostate's hard as shit. Okay. That's bad.
Yeah.
Yeah. You're in there and you're like, oh boy, like that thing is hard as hell. Like, and it's misshapen. Then you're like, that's probably cancer.
Hmm.
In acute bacterial prostatitis, you put it in there, their prostate's like fucking Play-Doh.
Oh.
Like you push your finger and it'll just sink into that bad boy like fucking Play-Doh, and it hurts. It's painful. It's so inflamed. We call it a boggy prostate. And I mean, they have super high fevers. They have urinary issues. I mean, it's bad. So what happens is that can progress into sepsis. It can turn into a blood infection.
Jesus.
And those, yes, bacterial prostatitis is no fucking joke. It's nasty. I've seen some really nasty
So
episodes.
testosterone can cause that?
No, testosterone's not going to cause acute bacterial prostatitis. There is another type of prostatitis that's inflammation that is not defined by a bacterial infection. Okay. It's called chronic prostatitis. It's managed a little bit of different ways. In men that I would see that would have subacute prostatitis, this would be, I have urinary symptoms. I have pain when I urinate. Usually it hurts right at the tip of your penis, right? Called the glands. So you have dysuria. Okay. Maybe you have some urinary changes, frequency, urgency, over baseline, feeling of incomplete emptying, maybe some dribbling, um, this weird sensation down there when you go. That can be a subacute prostatitis where you don't have a fever, but you kind of have some urinary symptoms with it. I would treat all those guys with antibiotics first. And a lot of those guys would get better with antibiotics. You have to use them for a long period of time. The literature says up to 8 weeks, but I would always do like 3 weeks, reevaluate, and then I would give them a script and say, do it for 3 weeks. If you're better, wait a week. If you're better, you're done. If you're not, take the second, like 3 weeks worth. Okay. That's how I would do it. And then I would see them back in like 8 weeks. And a lot of times the guys were better. They were back to normal. But the guys that weren't, then if we've gone through 6 weeks of antibiotics, it's not a bacterial issue at that point. It's got to be something else. And generally, so we transition into chronic prostatitis at that point, and or prostatidynia is another name for that. And it's just like you've got these symptoms, but it's not bacterial nature. And how do you manage it? And you have to go with this really like big multimodal approach, alpha blockers, phosphodiesterase inhibitors, even finasteride in some cases has been used, or 5-alpha reductase inhibitors, amitriptyline, TCAs, gabapentin. I mean, there's a whole list of things you can use to try and treat this. The pelvic floor physical therapy works really well for those types of guys. Okay. Because their muscles get tight down there, and that's what causes that discomfort.
Oh.
So it's hard to say if this prostatitis, because there's different types. So you have to figure out what type you have and go from it. So it's kind of a catch-all term. So I'm assuming it's chronic in this case, but would the testosterone necessarily cause it? There's no direct link into testosterone administration into causing BPH.
Okay.
So there has not been established a really good link there.
But do you think, is there something that maybe when he takes the testosterone that, I mean, obviously he has this problem without the testosterone. Is adding the testosterone doing something to make it, I don't know, maybe the inflammation or do something?
It shouldn't.
Oh,
So
okay.
it shouldn't. So it could have been coincidental. It's a possibility. I don't know. There's a lot there. Again, I'm not his provider.
Yeah.
I can't really go through all the motions there. He's going to be beholden to who's ever dealing with him at that point in time.
Have you ever had to deal with this, like in your clinic? No.
Not in my current clinic. I've dealt a lot with prostatitis in the past. I mean, I've probably had thousands of cases of prostatitis I've dealt with. And chronic prostatitis is hard. It's very challenging to deal with. It can be quite debilitating to some men. But generally speaking, pelvic floor physical therapy has worked really well. The thing with that, though, is a lot of guys would quit. And this is for any therapy, because I would use pelvic floor therapy for women with incontinence too, and it works really good for that too. But they go and, like, their insurance only pays for so much, and the thing is you really got to do 6 to 8 weeks of it, because it's like you'll go for 5 weeks and you'll be like, this isn't doing shit, and then you go the 6th week and it's like a fucking light switch
changes,
bang,
right?
And then it's like that fast. It's like literally the next session could be like, holy smokes, everything's finally working. I mean, because they're training to either relax muscles or build muscles up. That's not going to change in 3 weeks, right? If I go to the gym and I'm working arms, like, I'm not going to see benefit after 2-3 weeks.
Right.
4 weeks, 5 weeks, 6 weeks. Yeah, I'm probably going to start to notice like the definition and the hypertrophy, right? So it's the same principle there. You have to put in a little bit more effort to get that out there. But a lot of people would quit because they'd be like, I'm not seeing any changes, and then see ya.
Yeah.
And like I said, treating it from a pharmacological aspect is challenging. And I've used combinations and sent people to pelvic floor physical therapy, and have taken them off medications later, as we kind of try to acutely control their symptoms, but then do something a little bit longer term.
Right.
So,
well, I think that last question, Josh, proves 2 things. Number one, finding a provider that is qualified is obviously important. Someone who knows what they're doing.
I would agree.
So that they can do that. And number 2, and most importantly, it proves that I am not a medical professional, because I can't even read the fucking words or pronounce the fucking words. So just so that's out there. I can't even pronounce the fucking words. So believe me, I'll just pass it along to the people that know. All right. So you can ask me the questions. Don't expect me to answer them.
I wanted to be a chef my whole life. And here I am. I went from, cooking weenies to looking at weenies. How'd that happen?
Right.
Wasn't on career day.
Making women happy. That's what we're doing.
They always joke with me about that, but it's, I don't know. It's something I never thought I would get into, but it feels rewarding to be able to help and provide this type of care in a weird way, I guess you could say. But it's cool. Yeah,
I think it's fun. I like it. I like talking to guys about it and talk back and forth. Tell me all their stuff. I mean, some guys get pretty, just shoot straight about their sex life and all that. I'm like, okay.
Yeah.
That's cool.
People are people, man.
Right. As long as you don't get too weird, there's some weird shit out there, but
there is some weird shit out there.
Yeah. But yeah. So, but that's good. So that was all those questions. That was 1 week's worth of questions. So we'll see.
A lot of questions.
Yeah. There was a lot. This was a busy week for whatever reason. I don't know what the deal is. Weather's changing. Water, I guess. Yep. Football season's in full gear. Everyone's crying about the tush push.
Speaking of football season, did somebody win by the tush push?
The Eagles.
Did they? Okay,
I didn't the tush push.
Watch that game. I know you won because it was against the Chiefs. I was too busy crying because the Steelers got their asses handed to them by the. Who did we even play? Shit. They're not even a great team.
I know I saw Aaron Rodgers running all over the place.
Yeah, who the hell we play? My gosh. It's like I'm drawing a blank. The Seahawks, that's who it was. And the Seahawks don't have a bad team. They're not bad, but they're not like Super Bowl contender worthy, in my opinion. At least not after like week 2. And like we looked awful. I don't know how it is being a Philly fan, but I can tell you how it is being a Pittsburgh sports fan. And it is very emotionally unnerving.
Yeah.
It's like riding a roller coaster. We could have the best team that I've ever seen 1 week and the absolute worst team the next week.
Yeah.
There is no consistency in anything. And that's every sport in Pittsburgh.
Yeah.
That's not just football. That's hockey. That's, baseball. Well, baseball, they just fucking suck. They've sucked
Right.
for years, but that's because their owner doesn't give a shit. And that's a different story. But, being a Pittsburgh like Steelers and it is an emotional ride because you just don't know what you're getting.
Yeah.
And it's hard because like you want them to be good. And maybe we've been conditioned because we've had so many championships in both sports, right?
Hmm.
Especially within like the past 30 years that, you could say maybe we're a little spoiled and we expect more out of
Right.
our
Exactly.
team, but it's a very passionate fan base.
Hmm.
And it's funny. I actually had a guy call me today, who's from Pittsburgh originally. And when we say somebody's from Pittsburgh, they're not like from Pittsburgh. They're
Right.
from like
Right.
the surrounding
Around it.
areas
Right.
around. Yeah. Where you're like 30 minutes away. Right.
Hmm.
I'm originally from Western Pennsylvania, about an hour from Pittsburgh. When you become a Pittsburgh sports fan, you're born into it. Like I was born into being a Pittsburgh fan because that's who everybody in my family did. That's the part of the
Sure.
state that we were from. Like, I actually had an Eagles jacket when I was a kid. I was like the rebel. I'm like the Philly guys, and that's because they had Randall Cunningham. And he was
Absolutely.
boss. Yeah.
Yeah.
So like I don't discriminate it, but boy, being a Pittsburgh fan within the past like 10 years has been extremely disappointing.
Yeah.
So I'll still root for him though.
Yeah. Well,
So,
being a Philly fan, we have highs and we have minimal highs and pretty moderate. That our teams are very moderate over a lifetime, like
mhm.
my lifetime. So I was born in '79. The '80s, we had the Sixers win a couple championships, but
And before you were born, you had the Flyers do well. It wasn't that in the 70s where they
correct.
won a couple of those
That's
Stanley
when they
Cups.
were the Broad Street Bullies.
Yep.
And then we've had a few runs in the late '90s with
Mhm.
Lindros. Recently, they had some, but the Flyers haven't been very good for a while. The
Right.
Sixers are hit or miss.
Right. They're kind of hit or miss.
The Phillies recently have been on a good run. The
Yeah.
Eagles recently have been on a good run.
Yep.
So those two teams are pretty solid. You can expect them to make the playoffs, make a
Right.
run, you know. But hockey and basketball are like right now.
Right.
But usually one of them, so if one of the other one drops, maybe. So if baseball was to slow down, the Eagles don't look as good as they did last year. I'll tell you that much.
They don't. I will say like the league as a whole looks a little bit more even keel this year.
Yeah,
Like there's nobody that I'm watching that I'm like, wow, these guys just look like they're going to crush everybody. Now, granted, it's been 2 weeks, but
yeah,
I'm not really seeing like, man, there is teams are just going to stomp everybody.
yeah,
Um,
yep,
I'm sure that'll be more evident by like week 10, but
yeah.
be interesting
It
to
will
see
be.
what happens.
Yep. But everyone's crying
So
about the tush push. I say keep it.
I say keep it too. I mean, it's defendable,
Yeah. I mean,
not
it's
very
it's
well,
a
but
weird play. I don't know. I mean, it's a version of the quarterback sneak, but
yeah, we just have somebody come behind you and push you, and you get
yeah,
that momentum, and it busts
yeah.
you through. So,
I mean,
so if the quarterback can tush push, then can't you do like a linebacker tush push to
no,
push
you
into
can't.
them?
You're not allowed to do that. That's where we get into the weeds of this.
I see.
Can't a defender can't push another defender, but an offensive player can.
Okay. Well, then then that makes the case to not have it then.
Right, exactly.
So I would say
Exactly. I
because if
mean,
you
you have
can
to
only do it on
understand
one
something.
side,
Uh, Jalen is very strong. He's very like he's got very powerful legs. He's
yeah.
a strong dude. So that there is one thing. Like, okay, you have that. Then you have Saquon,
Who
who's like
is even
who's a
stronger?
fucking beast,
He's got horse
shoving him
legs,
forward. So
right?
it does create an unfair advantage. I
Yeah.
will say that. And the guys do jump. It's kind of a weird fucking play because literally the defense and most of the offense line up off sides. They're just like all jammed in there. It's kind of like a rugby scrum,
Yeah.
but it's working. The Eagles are winning.
Yep.
So I
Do you
think
watch college at all? College
I do.
football?
I do.
Who do you follow for college football?
I don't follow like a specific team, but I will watch a lot of like the big. Obviously, we watch Penn State. I mean, that's
Yeah.
just on here. But we'll do like my son likes Ohio State just because
Okay.
like his football coach is an Ohio State fan, so he's
Got
always
it.
talking about it. So he like, I mean, he doesn't really like them. He just will be like, "Oh, is Ohio State playing?" So we'll do that, and then because he'll talk to him about practice about the game. But like any of the big games, You know, like
Yeah.
the Saturday night games. It's weird that, like how the schedule is because some of these college fucking games are like 12 o'clock in the afternoon. It's like number one versus number two played at 12 o'clock
Right.
on a Saturday instead of a 7:30.
Right. They do have weird times, but there's a
Yeah.
lot of teams,
Yeah.
you know.
SEC
So
football is my favorite.
you like I said, I like Big Ten. Big
Yeah.
Ten's gotten very competitive. I do like SEC
Yeah.
showdowns too. I I will say it. I don't know. It just depends. I think some of the Big Ten rivalries are really good, but it seems like there's a lot more SEC rivalry
Yes.
than there is like in any other conference. Like they're always shitting on each other
Like
down
my
there.
like perfect fall day, like November where it's kind of cold out and you just want to watch
Mhm.
football. Like my ideal team to a game to watch would be like Alabama at Auburn between the
Oh
hedges,
yeah, yeah,
3:30 on a Saturday. That
yeah. That'd be
shit
a good
just
game,
is fucking fire, dude. They're
right?
just, I mean, they're
Georgia
all
versus South
NFL athletes,
Carolina
you
or
know?
Georgia versus Tennessee that
Yeah,
they just had
Georgia,
on. Which
yeah,
did
Georgia,
you see that
Auburn.
game,
Yeah,
dude? That game was wild.
fucking tremendous.
The
College football
kicker,
is fucking way underrated.
it's good, dude.
There's a
They
lot of
still have
people
their
that are,
heart in it.
yeah, a lot of people are NFL guys that don't really get into. I have like one of the guys that I coach with. He really does. He's a big Packers guy, and he's like
Okay.
all NFL watches, you know. But he's like, yeah, I really don't watch college football. I'm like, dude, you're fucking missing out, man.
Yeah,
Because there is some fucking that shit is addicting.
it is.
And
It's
it
fun
goes
to
from
watch.
12 o'clock at Saturday all the way till fucking midnight. I used to
Yep.
be like a degenerate fucking gambler back in the day. I would bet on fucking Hawaii kicking off at 12:05 on Sunday morning, playing like the fucking Air Force or something. It's
Right.
like, yeah, I'd stay up and watch that shit.
Yep.
Oh God, it was
Yeah.
really
I
good.
have. I obviously I follow Penn State because I went to Penn State, but and like a lot of my friends went to Penn State too, so we obviously follow them, and that's up kind of my neck of the woods
Hmm.
too. Um, where I was from originally. But I will flip to another game. Like Penn State played, I remember who they played last week, and it was like kind of a blowout game. I
Yeah,
was like, what else is on? You know what I mean?
right.
Like it
Yeah,
wasn't worth watching it because
yeah.
they were just gonna like they were just destroying
It's
this
I hate
team.
when they do like they played Villanova. Like
That's who it
Villanova's a
was,
one double A team.
right?
You know what I mean? It's like, come on.
Well, I heard my friend telling me who also went to Penn State saying I guess they get contracts to play like these smaller schools, and that school gets paid money
They
to
get paid a
play.
fuck ton of money. That's
I
why they
heard
do
that.
it. I mean, they
Yeah,
know they're walking into the fucking wood chipper. I mean,
right,
Villanova's a one double A school like that, you know, seats, 5,000 people. And
right,
like you're literally walking into the number two ranked team in the fucking country that's
right.
110,000 people in
And
there.
B Stadium's huge. It's one of the
Yes.
biggest stadiums, and I think only Michigan Stadium
You
holds
are
more.
literally walking into a fucking wood chipper. So it's
Yeah,
like, but you're going to do it because you'll get 2 million bucks or whatever it is.
gotcha.
Like, fuck it.
And
So
that actually might fund their whole athletic program for the
yeah,
year
yeah,
for
exactly.
football.
And in
So
all fairness, they played pretty good in the first half, and
yeah,
then
and then it
things
just kind of
then it went downhill. Although the
went
fucking
downhill.
touchdown at the end was absolutely fucking tremendous
It
on the
was.
last play of the game. That catch was amazing, and on top of that, fucking Villanova covered on that catch.
Uh-huh.
That's fucking insane. Imagine if
I,
you took fucking Penn State. And then they fucking lose on the last second on a fucking TD that means nothing on a
means nothing.
ridiculous catch.
Yep.
That's why I don't bet anymore.
Yeah, that's. I actually saw a video that was showing that like it ruined a lot of people's bets.
That's why I don't bet anymore because anything that I take, I know Vegas is looking at my phone like, no, they call it in. Like last
Yeah.
second, we're gonna backdoor this fucker. That's the story of my life. That's why I don't do it anymore. I'm like, fuck
Yeah.
this. Yep. So, all right, Josh, we'll wrap this up. If you guys have any more questions, feel free to send them over. You can do it on TikTok. I think I said this last time on the podcast. You can message me on the podcast, but I cannot message you back. So if you do have a question, you can ask on TikTok or you can email me at thetrtdad@gmail. And if you have anything, you can send to Josh too. I've been seeing Josh's videos pop up on
Yeah, I got the
TikTok.
new content rolling. I hope
Yeah.
you like the format. I like the little like typewriter intro. We've got all those. I have I think 3 videos I've posted. I posted one today. Um, I've got a longer video that's coming out. It's like 2 minutes.
Hmm.
It's pretty cool. Has some footage of me working out in it. So,
Nice.
and I think there's maybe some footage of me playing hockey in it as well. I don't know.
Cool.
So it's pretty cool. It's like a 2-minute video, so I don't know how how much attention span it's going to gather, but
You have to
um,
try to do, I know it's hard, but if you can do it every day, even if they're stupid things, the algorithm, I've noticed
catch
that.
up.
That's why I
I'm
make some
shooting
stupid
for
memes and send them
3 a
out.
week.
Yeah.
So, and the only reason I'm shooting for 3 a week is because these videos, like if it's memes, I understand. But my videos, like if I post one and I post another one, then it's sort of like that one doesn't get circulated, right?
Mm.
And it's hard because like my videos are trying to be a little educational.
Yeah.
So I don't want to post them in like too close of a post cadence because of that reason. So
Yeah.
we'll figure it out. But at
Yeah.
any rate, I'm getting a lot more content out there, or we'll have a lot more content out there built over time versus what I was.
Absolutely.
So
Good. Well, then people can find you. Where can they find you on TikTok?
it's Joshua underscore VHO.
Nice.
And I don't think people realize who I am sometimes when I comment on these videos, which is, hey, it's fine by me. I'm covert.
Yeah, that's the way to do it. That's the best
So
way to do it.
yeah, and they're like, who is this guy? You know,
Yeah.
what kind of comment is this? He acts like he knows what he's talking about.
Yeah, who's this D-bag think he knows
Yeah,
everything?
you fucking asshole.
Yeah.
Dickbag telling me not to take in clomiphene. Fuck that
Yeah.
guy.
Yeah. This fucking guy knows what he's talking about. Fuck him. Oh. All right, Josh. Until next week, we'll wrap this up and then I'll talk to you later.
All right, brother. Sounds good.
All right, bud. Take care.
Yep. See ya.